Today I would like to speak on the risks of cosmetic surgery procedures. I will be discussing the physical, emotional, financial, and overall health risks that come with cosmetic surgeries. Whether you or someone you know is thinking about undergoing a cosmetic procedure, it's important to know all of the risks before making your decision. Being a female and exposed to social media, the concept of cosmetic surgeries have become very normalized. I understand that undergoing cosmetic surgery is something to seriously think about cost-wise, but the health risks are also factors. In 2016, Americans spent over $16 billion on cosmetic surgery procedures. From breast augmentation to rhinoplasty, procedures to change our appearance are becoming increasingly common. But these surgeries don't come without risks. If you're thinking about plastic surgery, it's very important that you are aware of both the benefits and the risks. Cosmetic surgery rates have skyrocketed over the past 8 years. Due to social media and entertainment normalities, the idea of perfection has definitely changed due to influencers and reality stars. As a millennial and social media user, I know firsthand that cosmetic surgeries have a prominent presence in our entertainment world. As Anna Schaefer notes in her February Healthline article, The 10 Most Common Plastic Surgery Complications, last year 64,000 cosmetic procedures were performed on individuals between the ages of 13 and 19 years old, 249,000 cosmetic procedures were performed on individuals between the ages of 20 and 29 years old, and 365,000 cosmetic procedures were performed on individuals between the ages of 30 and 39 years old. Facial cosmetic procedures have become increasingly popular. Facial cosmetic procedures include rhinoplasty, facial implants, neck lift, facelift, cheek augmentation, dermal fillers, brow lift, and even eyelid surgery. Although these procedures seem like minor adjustments, they could be pretty extreme to your health. Some things to be aware of before you decide on undergoing one of these procedures are all the possibilities that could take place. Hematoma is a pocket of blood that resembles a large, painful bruise and is the most common complication after a facelift. Hematoma is a risk in nearly all surgeries, and treatment sometimes includes additional operations. Paralysis, nerve damage, and facial scarring are also common complications after undergoing facial procedures. Jenna Garbrow makes a point in her June Forbes article, The Hidden Dangers of Cosmetic Surgery, that changing one feature sometimes throws off the appearance of others, such as plumped lips may make a normal-sized nose suddenly appear obtrusive, resulting in wanting another procedure done. Body cosmetic surgery rates are higher than ever. These procedures include tummy tuck, breast augmentation, butt lifts, and liposuction, to name a few. Infection, scarring, organ damage, seroma, and blood loss are common results and complications when undergoing these treatments. Anytime you tamper with the body's balance, you risk creating new problem areas. It was discovered that liposuction may slim one area while creating another. Women who suction fat from their thighs and their lower abdomen ultimately destroy those fat cells. When they eventually put the weight back on, it distributes unevenly, often to less flattering areas like the upper abdomen, back, and arms. Financially, cosmetic surgeries are very demanding. Robin Yun, a plastic surgeon and author of the book Behind the Mask, Beneath the Glitter, notes that many patients borrow money for the initial surgery. If they need an additional procedure, follow-up costs can devastate their financial lives. Another financial risk is traveling abroad for surgeries or dissatisfaction with results and need for secondary surgeries. Sometimes a patient or their doctor may realize after they've invested the money and time into a procedure that they have an underlying issue rather than a physical one. Which brings us to the psychological and emotional risks that come along with cosmetic procedures. Patients may never be fully prepared for the mental and emotional costs of cosmetic surgery. The stress of surgery, lack of sleep, and recuperation that often includes pain, fatigue, and swelling causes most to experience some degree of depression. The general emotion arc after surgeries begin with depression as you heal, then shifts to a honeymoon phase when you can see the result, but soon morphs into some measure of disappointment. Even if the procedure was an improvement, they become deeply disappointed when the result isn't perfect. Throughout my speech, I gave examples of risks that come along with cosmetic surgeries. I hope the information that I've offered today will help you decide in your process of thinking about undergoing cosmetic surgery. Thinking about receiving a cosmetic surgery is something to analyze and think through. Knowing the benefits and the risks can help you make a proper decision on if it's worth it.